Hi everyone, so today we're going to discuss about meningitis. Alright, let's go into the topic. And what is meningitis? Any word ending with the word with this itis is known as the inflammation. Okay, so meningitis is the inflammation of the meninges. What are meninges? Meninges are the layer covering the brain and spinal cord. So that is the meninges. Alright, so inflammation of the arachnoid and pia. Now that's just the fancy words for dura mater, arachnoid matter and the pia mater. That is the meninges has got three layers. They are just the pia mater, arachnoid matter and the dura mater. So they three comprises of the meninges, and this meningeal layer inflammation is known as meningitis. Alright, whenever there is an inflammation, there will be massive brain swelling. So there will be a swelling. So whenever there is an inflammation anywhere in our body, we will be having redness and swelling. So as such, the brain will be also having swelling. So the swelling can lead to deadly increase in the intracranial pressure. So the ICP is nothing but the intracranial pressure. So as there is a brain swelling, the intracranial pressure also increases, which can eventually lead to death. Alright. So this can be either bacterial or it can be viral. So let's go into the causes. The causes of meningitis can be an infection, and this infection can be either bacterial or it can be viral. And there can be any head traumas. What are head traumas? Head traumas are nothing just but the trauma. Trauma is an injury, so a head injury. Or it can be an autoimmune diseases like lupus, wherein the body attacks itself and kills their own cells. So whenever there is a bacterial infection, it's a bad news, okay? So it's very contagious. And whenever there is a viral infection, and that's very common. Okay, so think about B for bad news, and that's very contagious, wherein V for that's very common. Alright, so coming to the signs and symptoms. So for the meningitis signs and symptoms, you have to remember this 3H. Alright, the first H stands for headache and photophobia, wherein the second one stands for hard, stiff neck, and which is known as knuckle rigidity. And the third H stands for high temperature, and that is fever. Okay, so remember this 3H: headache, hard stiff neck, and high temperature or fever. When you go to the pediatrics, you can see high pitched cry, and even you can see bulging fontanelle. So we have an anterior fontanelle and a posterior fontanelle in our pediatrics. So that will be bulged, and there will be also high pitched cry. Remember these terms, guys, they are NCLEX favorite terms: high pitched cry and bulging fontanelle. Okay, whenever you hear this, you have to think about meningitis. Alright, so when you go into the adults, you could see agitation and altered level of consciousness, and that's a first sign. So never miss the first sign. Alright, altered level of consciousness. That's very serious. So whenever you see this altered level of consciousness, think about something very serious. Alright, so leads to seizures, coma, and that can lead to even death. Alright, and the next one, the diagnostics, and this is very important. There will be positive Kerning sign and positive Brudzinski sign. So what's a positive Kerning sign? Laying on the back and straightening the leg is very painful. So you can see in the picture, a person is laying on his back and the nurse is trying to straighten his leg, and he is crinkling with pain, right? So whenever there is a Kerning sign, that is crinkling with pain. He is not able to straighten his leg, okay? So what is a positive Brudzinski sign? When the neck when the neck flexes, hip and knees also flex. So that is a positive Brudzinski sign. So that is on the second picture. So the nurse is trying to flex the neck, and the person involuntarily moves his hips and knees. All right. So you can see it's in a shape of a B chair like this. It's in a shape of a B chair. Okay. So the Brudzinski, remember, B chair. Kerning, the person crinkles with pain. Brudzinski, it's a B chair. Okay. Don't forget these terms. These are important for NCLEX. All right. Let's go into the next one. All right, the test is, there can be CT scan, which is usually done first. That's a computer tomography. And then LP, lumbar puncture. You might be familiar with this term. So lumbar puncture is nothing, it's also known as a spinal tap, wherein you will aspirate a certain amount of cerebral spinal fluid. You can see in the picture, so she's aspirating some cerebral spinal fluid. So if it's viral, it tends to be very clear. Okay, remember, if it's viral, it is very clear. And if it's bacterial, it's bad and cloudy. All right, both the types will have elevated WBC. So usually what does an elevated WBC signifies? That there is some infection. So both of these are infections. Even if it's viral or bacterial, they're both infections. So there will be elevated WBCs when you see the CSF. All right. An important thing which you have to remember once after doing the LP is monitor the insertion site dressing for clear fluid. Okay, you have to see the insertion site dressing for clear fluid. That will be a drainage of the CSF. Okay, and that's very important. You have to notice for that. All right, let's go into the next one. Interventions. Okay, when the patient is diagnosed or the person is diagnosed with meningitis, then you have to, the very first thing that you have to do is you have to place the patient on droplet precautions. Okay, you have to place the patient on droplet precautions, and you have to wear PPE, that is the personal protective equipment. All right, so there is a droplet, so there are certain, infections where you have to follow the droplet precautions, and there are certain infections where you have to follow airborne precautions. All right, so remember PIMP, this is a P for pertussis, I for influenza, M for meningitis, and P for pneumonia. Okay, that's pertussis, influenza, meningitis, pneumonia. These are just few NCLEX favorites. There are few others also, but then these are the NCLEX favorite ones. Pertussis, influenza, meningitis, pneumonia. Okay, so you have to keep the patient on droplet precautions. So wear a surgical mask and goggles. You have to keep the patient in a single room, and you have to teach the unlicensed personnel to wear a mask. Who's an unlicensed personnel? A UAP. Okay, you have to ask the UAP to wear a mask. All right, so these are the things you have to do when the patient is diagnosed with pertussis, influenza, meningitis, or pneumonia. Okay, same things. Surgical mask and goggles should be put, single room it should be, and then teach the unlicensed personnel to wear a mask. All right, when it's airborne, it comes to measles, tuberculosis, varicella. It can be shingles, chickenpox, varicella zoster, and the other one. So it can be varicella shingles or chickenpox. And yeah, so remember this MTV. All right. So things you have to do is you have to wear an N95 mask. Here it was a surgical mask, but then here it is an N95 mask. Okay, remember, if it's airborne, it's contagious through air, so that you have to wear an N95 mask. And the room should be a negative pressure room. Since it is airborne, the room should be a negative pressure room, and the door should be closed. And on transporting the patient, you have to make sure that the patient wears a surgical mask. That's a surgical mask, not an N95 mask. So remember these things. These are very important. So remember this. All right. So we'll go on to the next one. Okay. Okay. So the next one, interventions. So you have to make sure that there is no decrease in BP. You have to see the BP is always on a limited range. So there should not be any risk for low BP. And hypertension or low BP will definitely kill the patient. All right. So, and you have to make sure there is low noise, and you have to make sure there is low light and low pressure all over. That is no coughing, no sneezing, no bending extremities, and raise head of the bed at least 30 degrees, no lying flat. And early sign of increased ICP are altered level of consciousness, as I have mentioned before, restlessness, irritability and agitation, and decreased mental status. All right, so why are we keeping a low noise room or a low light room? We don't want to trigger the patient and increase the ICP. So, and there's low light, there is a risk for photophobia since the patient is diagnosed with meningitis. So we have to keep them in a low light room, okay? And low pressure all over. We don't want to increase the ICP. So we need to make sure that patient does not cough, patient does not sneeze, and patient does not bend either of their extremities. All right, and we have to raise the bed at least 30 degrees. And these are very important. Altered level of consciousness and decreased mental status. Okay, so whenever you see that options on your questions, they are important. All right, so this is a little side note. When you put on or when you take off your PPE, all right? Okay, so when you put on, it is known as don, and when you take off, it is known as doff, okay? So when you put on, you have to put your gown on, okay? Gown, that's the first thing you have to put when you put on the PPE. So remember this, G, gown, M for mask, G for goggles, and G for gloves. So when you put on, you have to see G, M, G, G, okay? That's how you have to put on. Gown, mask, goggles, and gloves, okay? First, you have to put the gown, and then you have to put the mask, and then you have to put the goggles, and then you have to put the gloves. All right, so G, M, G, G, remember. And when you take off, you have to put the gloves, you have to take off the gloves first, and then the goggles, and then the gown, and then the mask. So remember G, 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 and at last you have to take off the mask. Okay? So here it is G, M, double G, there it is triple G, and at the end M. So when you take off the gloves, goggles, gown, and mask. All right, hope you understood everything. So if in case you need any assistance, you can definitely contact us, contact IRS Group, and thank you for listening. We'll see you with the next topic.